Welcome to Navigating the Medicare Maze. Please remember the information provided in this web seminar is not intended as a substitute for your physician's guidance and care. My name is Sarah Rothschild, the LRG Senior Director of Programs, and I am your moderator for today. At this time, I would like to introduce our presenter today. Melissa Simpson is a Senior Program Manager in the Center for Benefits Access at the National Council on Aging. She delivers training and technical assistance to state aging organizations related to Medicare and other policy questions. Melissa has extensive experience working with Medicare beneficiaries as the State Health Insurance Assistance Program Director in Arkansas, where she led education, outreach, and enrollment of people with Medicare into public benefits that make Medicare affordable. We would like Melissa to start her presentation. Thank you so much for joining us, Melissa. You may begin.
Thank you, Sarah. Thanks so much for the invitation to speak to your group today, and thanks to all of you for joining to hear a little bit more about Medicare, because this can be a pretty confusing topic. I want to share just a little bit about the National Council on Aging, NCOA. This is where I work. NCOA is a nonprofit organization that celebrates 65 years this year. We work towards improving the lives of older adults, particularly those that are struggling. We have this social impact goal to improve the health and economic security of 10 million older adults by 2020, which is a pretty big goal, and you guys are part of that, so thank you for inviting me to share today. What we'll do most of the next hour is talk through these questions that you see on the screen. It looks like we have a good number today, so as I speak and you have questions, please chat them in. I'd like to pause a couple of times along the way and answer some of the questions if you have them. So don't feel like you need to wait till the end to type in your questions. Please just go ahead and do it as we go. So these are sort of the top Medicare questions that we tend to hear from folks. They want to know, when are folks eligible? Do they automatically get Medicare, or do they have to enroll? What if they're still working or still covered by an employer insurance? And what should they get with Medicare? Should they get a Medigap policy or a Medicare Advantage policy? So we'll talk about the difference in those two a little. We'll talk about paying for Medicare. How do you afford it? Is there any help paying for it? Whether you should get a Medicare Part D prescription drug plan, as well as ways to find out what Medicare pays for and what it covers, and how to find a doctor. So that's the main agenda for today, is to walk through these questions. I actually have a couple of poll questions for you guys. The first one is, how long have you been enrolled in Medicare? So if you'll answer these questions, this helps me sort of know how much detail to provide about this sort of basic Medicare information. So you would just let me know if you have been in Medicare 1 to 3 years, 5 to 7 years, 8 years or longer, or maybe you don't have Medicare, you're participating in the call for someone else. I'll give you just a couple more minutes to make those selections. Well, not minutes, seconds, I guess. So it looks like we have about half of folks have been able to respond. So it looks like it's a bit of a mixed bag. About nearly half have been in 1 to 3 years, and then closely followed by not yet enrolled. And I see someone chatted in 2 years, so maybe the polling moved too quickly. So that helps, thanks. So most of you guys are pretty new. Second question is, are you enrolled in a Medicare Part D drug plan? Just yes, no, or you've got some drug coverage, but you're not real sure if it's a prescription drug plan through Medicare or something else. I'll give you a few seconds to answer that question. Okay, so pretty even spread there between yeses and nos. So we are going to spend a good bit of time sort of in the second half of the presentation talking about Part D, how to compare those plans. So hopefully you'll find that helpful. So going back to these questions, the first one is who's eligible for Medicare? So, if you're already enrolled in Medicare, maybe this is not as relevant to you, but if you're not yet, these are good things to know. So there is a citizenship requirement for Medicare. That's the first bullet point. So folks that are eligible for Medicare are U.S. citizens, or they've lived legally in the U.S. for at least 5 years consecutively. There's also an age or a disability component related to Medicare eligibility. So as you can see under the second main bullet, it's mainly for folks age 65 or older. Folks under 65 can get Medicare if they've been drawing a Social Security disability benefit or income for about 2 years or 24 months. The other reasons folks under age 65 might have Medicare is if they've been diagnosed with one of these two very specific diseases, end-stage renal disease, which is kidney failure basically, or Lou Gehrig's disease or ALS. Second is Medicare automatic. So Medicare enrollment is automatic for some people. The first bullet shows that it's automatic for folks that draw a Social Security or a Railroad Retirement Board benefit, or basically a retirement check. So folks that are already receiving a retirement check from Social Security or Railroad Retirement are going to get a Welcome to Medicare packet in the mail. It will come to them 3 months before their 65th birthday. Actually, a lot of mail begins to show up in your mailbox around this time frame. It also happens when folks are reaching the 25th month of drawing a Social Security disability income. So that's those under 65 folks that get Medicare. So what's in the packet? On the right you can see the packet contains something called the Initial Enrollment Questionnaire. So that's your opportunity to tell Medicare that you might have some other insurance than Medicare, or you're ready, you want to sign up for Medicare, and you send that back to Medicare. Or more recently, they've really been pushing folks to sign up for mymedicare.gov accounts. So you can complete that initial enrollment questionnaire in a mymedicare.gov account also. The other thing that's in the packet is this Welcome to Medicare booklet. You can see a screenshot of it on the left-hand side of the page. And the Medicare card also comes in the Welcome to Medicare packet. So that's for folks that automatically get Medicare, but there are some folks that do not automatically get Medicare, and these folks actually have to take steps to enroll. So this is the third question. If I don't automatically get it, when do I enroll? So for folks that do not yet draw a Social Security or a benefit check, they have to take some steps to enroll in Medicare. There are some different enrollment periods listed here under the second bullet point, and we're going to talk about all three of those and look at why you would use one of those different enrollment periods over another. The last mention on this slide is where you can go to sign up for Medicare. So you actually sign up for Medicare through the Social Security Administration. You can do that at a local field office, or you can do it online now. You can go to their website, which is ssa.gov, and you can see I'm pointing with that red arrow to the Apply for Medicare button. So if you need to sign up, if you have to actually do something to sign up for Medicare, most folks want to do it during their initial enrollment period, and that's what you see on the screen now. It's a 7-month period that surrounds your 65th birthday. So it's 3 months before your birthday month, so you can see those 3 little calendars, then the month of your 65th birthday, and then 3 months after. And what you can do during this time frame is listed on the right. You can sign up for all parts of Medicare, Part A, Part B, Part C, and Part D. So we're going to talk a little bit about the different things that those different parts of Medicare do as we go through the presentation today. I also wanted to point out on several of the slides I have at the bottom right-hand corner links to places to get more information about what's on the slide. I'm going to talk about a lot of stuff related to Medicare today, and sometimes these details can get a little overwhelming. I assume that most of you guys, because you are participating in this because you are a GIST patient or because you care about someone who is, you have likely become a bit of an insurance expert. But Medicare is complex and it changes. So on this slide, I'm giving you a link to a website that NCOA has created called mymedicarematters.org. And there's a whole section on understanding these enrollment periods. Granted, if you're already in Medicare, maybe this is something that you don't need to concern yourself with any further, but I just wanted to point out those resources are available. So the initial enrollment period, going back to it, it's the 7 months surrounding your birthday month. We encourage folks to sign up at this kind of like top area here before the month of your 65th birthday. And the reason we do that is because the box down in red shows the months that there's a delay. So if you wait until after the month of your 65th birthday to sign up, there's a delay in the start of your Medicare benefits. And if you don't have some other insurance, you need to be careful about delaying your enrollment. So just be mindful that those things happen if you wait until later in your initial enrollment period to sign up. On the next slide, it talks about signing up for Medicare Part D during the initial enrollment period. So this works a little bit differently than the last slide where we were talking about Medicare A and B. So with Medicare Part D, the part that pays for prescription medications, when you enroll, the coverage just starts the following month. There's not as big a concern about enrolling when you're first eligible. On the next slide, this information about the general enrollment period applies when a person misses their initial enrollment period. So we think, it would be potentially tough to miss your initial enrollment period because you're going to get really popular. You're going to get a lot of mail from a lot of insurance companies that want to sell you Medicare products. But on occasion, people miss it. And if they miss it, this is their opportunity to join. The opportunity is called the general enrollment period. So you can see on the screen these different time frames when you can sign up for different parts of Medicare. I'm not going to go into a lot of detail about this because it's not likely to apply to many of you. We do have a resources slide at the end of this presentation. If this applies to you or any of these sort of more exceptional circumstances that we might talk about today and you want help figuring these out, we've got a list of good places to go and get help. I just wanted to bring to your attention that there are options to apply, but that you might have to pay penalties if you don't sign up when you're first supposed to. So let's see if we can apply this. So we've got a scenario here about a lady named Maria. Her 65th birthday is in November of 2016, and she's going to celebrate by retiring. Since she's been working, she's not been drawing a Social Security check, and she wants answers to these two questions. She wants to know, when is her initial enrollment period? And second, does she need to do anything to enroll in Medicare? So we've got a couple of polling questions I'll ask you guys to respond to. Again, the first one is, when is her 7-month initial enrollment period? You'll remember that it has something to do with her birthday. So her birthday is in November, and it's a 7-month period. So do you think that the answer is from May to November, from June to December, July to January, or August to February? I'll give you just a couple of seconds to answer or to make a guess. Okay, great. So it looks like most of you guys have answered. Let's see what you thought. So, hey, most of you answered correctly. The correct answer is August to February. So remember, her birthday month is in November, so 3 months before November would be August, and 3 months after would be February. Yeah, good job. Okay. The next question is, does Maria have to do anything to enroll in Medicare? So do you think, yes, she needs to sign up through SS, which is the Social Security Administration, or is the answer no? She is automatically going to get it when she turns 65. Okay, great. Looks like most of you guys have answered. And correctly. So because Maria has not been drawing Social Security yet, she's actually got to take some steps to enroll. Yeah, so she needs to sign up at the Social Security office or online. Either one works. So that's for folks that are retired, no longer working. But what if, so this is another question we get pretty frequently from folks, what if you're covered by an employer insurance? So this could be because you're still working or because your spouse is still working and you have coverage based on their work. So the considerations for folks that still have employer coverage based on current work are a little different. So this slide details that. So if you've still got coverage, this is this sort of briefcase-looking green thing. If you still have coverage from your employer, you can enroll in Medicare, but you might not need to. And on the next slide, we're going to spend a little more time talking in detail about why you might not need to. And also because if you're covered by an employer insurance, that second bullet says you can get a special enrollment period. So this is for folks that have, it's technically called employer-sponsored group health plan, but it just means that you've got insurance through an employer. That you can actually delay Medicare and get this special enrollment period. And that special enrollment period, it lasts for 8 months after your employer coverage ends. In that 8 months, you can sign up for Part A and or B. You also get a special enrollment period. You can see those little 2 months over there. For 63 days, you have an opportunity to sign up for Medicare Part C or Part D. So those time frames are quite different, 8 months versus 2 months. So if this describes you when you are approaching this time frame, I would encourage you to reach out to some of the folks on the resources slide that we've got listed later as a reminder about when to sort of make these decisions. I did list at the very bottom of the slide, there's a couple of exceptions to this rule. So one of the tough things about Medicare is every time there's a rule, there's going to be an exception or two. So these are some common exceptions. So if a person is drawing a Social Security benefit check, it's pretty hard for them to decline Medicare Part A. If someone has TRICARE benefits or retiree coverage or COBRA, then they would need to sign up for Medicare. But beyond those exceptions, generally you can delay Medicare Part B. So on the next slide, this is a lot of text, but it defines like why people might want to delay enrolling in Medicare if they're covered by an employer plan. So the first thing is really financial. Medicare Part A is typically free, but if you've been drawing a Social Security benefit check and you decline Medicare Part A, you say, I don't want it yet, then you have to be willing to pay back all of the money that you've been paid by Social Security. So most people are not wanting to do that, so they go ahead and sign up for Medicare Part A. As for Medicare Part B, the next bullet, there's actually a monthly premium for it. This year in 2016, folks pay $121.80 a month for it. And if you have a higher income, you pay more. So, if you have employer coverage that you're paying for, maybe you don't want to pay another $120 a month to have Medicare also. Medicare Part D, it also has costs associated with it. The average monthly premium, you can see there's $33.12. Then Part D plans have deductibles. For you guys, if you're taking Gleevec or the generic, you're going to hit the coverage gap, or also called the donut hole. And your costs, may be higher than your employer plans. There might not be much use for a Part D plan if you've already got coverage. And then with Medicare Part C plans, there's also a premium for those that you have to pay on top of your Medicare Part B premium. So financially, there's these costs to consider. The second half of this slide talks about Medicare's coordination of benefit rules, which just means, which insurance is going to pay first. And generally, down here at the bottom, the rules are if your employer has more than 20 employees at age 65 or older, or if the employer has more than 100 employees for a person who's younger and has Medicare due to disability, Medicare is going to pay second if you join Medicare and have employer coverage. So the thing about that is this very last bullet says your employer insurance is going to pay first, and Medicare is only going to pay if your employer insurance paid less than what Medicare would pay. So the basic result is it would be uncommon for Medicare to make a payment while you're also paying these extra costs up in the financial consideration. So it just may not be worth the additional money to sign up for Medicare. Another thing to consider, which I'm not going to go into great detail because it doesn't apply to a lot of people, but for those that it does impact, they need to know about it. If you have a type of employer plan called a high deductible health plan, you might contribute to something called a health savings account. If this describes you, there are some particular rules you need to pay attention to about Medicare Part A and making contributions to your health savings account. I have linked to a resource down here on the bottom right-hand side of the page. So if that particular circumstance applies to you, please take time to look at that resource or to contact someone on the resources page at the end of this presentation if you have additional questions. So if all of that seemed like a lot of detail and a little overwhelming, I have good news because this next screenshot shows a tool that the National Council on Aging has developed called My Medicare Matters. I mentioned that earlier. But this particular tool called Medicare Quick Check, it takes into consideration all of this stuff that we've just talked about for the past 20 minutes. So you go to the MyMedicareMatters.org website and you click up here in the right-hand side where this orange box saying Next Steps, and you get this enrollment questionnaire. The only thing it asks you to identify yourself by is your zip code. So you can use this without fear that someone's going to take your personal information or contact you. And the great thing about this site is that it takes into consideration all of those things about if you're still working or if you have TRICARE or if you might be contributing to a health savings account. So I would encourage those of you who have not yet started Medicare to go in and use this tool. It gives you a personal report based on how you answer the questions at the end. So it's a really great tool. There's also a good tool available at the Medicare.gov website that can help you estimate how much you might have to pay for Medicare. Like what would your premium be and when would you need to sign up. So take advantage of that tool as well. Let's talk through a scenario about a gentleman that might want to delay Medicare to see if that made sense. So Michael and his wife, whose name is Karen, they're both going to turn 65 this year. Currently, Karen covers Michael through her employer health insurance, and she's planning to work until she's age 70. Because Michael had to retire early because he had some health concerns. He retired early at age 62, and he's been drawing his Social Security benefit since age 62. So he wants answers to these questions. Does he have to enroll in Medicare A and B at age 65? Second, is he going to have to pay a penalty if he waits until later? And third, can he still buy a Medigap policy if he waits to enroll in Medicare later? So get ready for a poll question here. So the first one is, does he have to enroll in Medicare at Parts A and B at age 65? So just take your best guess. This one's a little tricky. The first option is yes, he needs both Medicare A and B. The second one is yes, but just Part A. The third option is yes, but just Part B. And then the final option is no, he doesn't have a need for either part of Medicare at this point. Okay, so looks like most of you guys have answered. Let's see. Hey, and you mainly answered correctly. Right, so the correct answer is yes, but he just needs Medicare Part A. So the reason is that Michael's in that situation we described where he's already been drawing a Social Security check, and if he were to decline Medicare Part A, he'd have to pay back all the benefits that he had received. So the correct answer to this particular circumstance is the second one. Yeah, good job, guys. All right, second, will he have to pay a penalty if he waits to enroll? So we just said he needs to get Part A. But what if he waits for Part B is what we're asking here. Yes, he has to pay a penalty, or no, he doesn't need to pay a penalty. Okay, let's see how we did. Boy, you guys are good at this. The correct answer is no. He can use that special enrollment period we talked about in one of the earlier slides, that he has a special enrollment period that lasts for 8 months where he can sign up for Medicare Part B after his employer insurance ends. And then it's got that weird thing about joining a Medicare Part C or Part D plan where he only gets 63 days. But so long as he signs up during those special enrollment periods, he doesn't have to pay a penalty. Good job. All right, so the next question, I had written it a little too lengthy to make it a poll question, so we'll just have to talk through it. So the final question is, can he still buy Medigap if he waits to enroll? And we didn't actually talk about this much, so I'm going to talk about it in some upcoming slides. So we want to know whether he can, maybe the first one is maybe he can buy it, but only if he can pass underwriting. The second one is no, he won't be able to buy a policy. He should have, bought it when he first had the opportunity. Or yes, but he has to buy it within 6 months. So the correct answer to this one is answer C. So we'll spend the next couple of slides talking about these differences between Medigap plans or Medicare supplement policies. You'll see them called that too, and Medicare Advantage plans or Medicare Part C. So another thing about Medicare that can get a little confusing is there may be more than one name to describe a specific thing, and that happens with these two. So let's talk through the differences in these two types of coverage. So you can see Medicare Advantage is the middle column, and the far right is Medigap policies or supplement policies. So both of these are sold by private insurance companies. The Medicare Advantage plans have contracts with Medicare. The supplement policies don't contract with Medicare because they don't pay Medicare benefits. They pay after Medicare pays. The second line says, do you have to use a specific network of providers? This is really important for folks, and I would suspect for you guys, there are probably folks that are specialists in your particular condition. So with Medicare Advantage plans, you want to be real careful to look at the network because Medicare Advantage plans usually require a network, and if you get in a plan that lets you go out of network, you usually pay a good bit more out of pocket to see those out-of-network providers. With Medigap policies, there's a specific type of Medigap called Medigap Select that has a network, and it's usually the premium's a little cheaper, but if you're not buying Medigap Select, otherwise you can just go anywhere to any provider that accepts Medicare, and your Medigap will pay after Medicare. So what about additional benefits? The Medicare Advantage plans are pretty attractive to folks because they can offer, okay, so they can. Doesn't mean they have to. So if you're looking at Medicare Advantage plans, be real careful to look at the specific details in the policy. Do they pay for vision coverage? Do they pay hearing? Do they pay dental or transportation? Some of them also cover something called Silver Sneakers, which would pay a gym membership, for you at a local club that participates. So folks like those features of Medicare Advantage. Just be careful that you know the details of those coverages. Medigap policies don't have as many additional benefits. I mean, they might cover Silver Sneakers, and some of the policies pay for foreign travel, like emergency care. So the next row says, is it primary or secondary? Medicare Advantage actually takes the place of Medicare. So it pays your bills for your doctors, for the hospital. It just replaces Medicare. And with Medigap policies, these types of insurance, they pay after Medicare. So what are they going to cost is the next row. Well, you pay a monthly premium for them. The premiums for Medicare Advantage, just like Medigap, they can vary pretty widely. You can see the sort of variance in cost on the screen there. What other costs would you have? So with Medicare Advantage, you pay co-payments or co-insurance when you go to the doctor, when you go to the hospital, and those vary from plan to plan. And then with Medigap policies, the other cost that you have depends on really which policy you buy. So on the next slide, there's a few more details about Medigap and Medicare Advantage. And these are important because it details when you have the right to purchase a policy without being turned down. So there's an open enrollment period for Medicare Advantage and for Medigap. So we mentioned it earlier, the Medicare Advantage as well as Medicare Part D open enrollment period. It's coming up. It starts October 15th and it ends December 7th. The only reason that a Medicare Advantage plan could turn you down is if you have end-stage renal disease. Otherwise, they can't turn you down for anything else. Medigap policies are a little different. The only time that you can be sure, or times you can be sure, are listed on this slide for Medigap. So there's a 6-month period after you join Medicare Part B at age 65 or older when an insurance company is required by law to sell you a policy regardless of your health. And then I say there some states have even more generous policies. So you would want to check with your SHIP program, which is listed on the resources slide at the end of the presentation, or your insurance department. With Medigap, this second row, there's also these guarantee issue periods, and these are like 7 rule-specific circumstances that might apply to you. So if you are interested in purchasing this kind of policy and you're outside the 6 months listed on the first row, there's a possibility one of these particular specific circumstances might apply to you. And you can learn more about those at the Medicare.gov website at the link there at the bottom of the slide. So there's 10 standard policies to choose from, and a lot of times people say, oh, just buy a Plan F. It's the one with all the green checks. It's the best coverage. And that's great. You can do that. It does have the best coverage. It's also usually the most expensive. So I put this red box around these 4 because I wanted to have you guys look at these for a minute, because there's not a great deal of difference between these 4 policies, and sometimes in what they cover, but sometimes the price you pay for them can vary quite greatly. So looking at Plan F, that's the one with all the checks, versus Plan G to the right. So the only difference there is that Plan G doesn't pay for the Part B deductible, which can go up, but this year it's $166 a year. So you kind of want to look at the difference in the costs for the premiums for the Plan F minus the Plan G versus the Plan G, and figure out whether covering $166 a year is worth paying more for Plan F. Sort of same deal about Plan C and Plan D versus Plan F. You can see the differences in those versus Plan F. This line, the second to last one that talks about excess charges, what that means is an excess charge is if you go to a doctor that does not accept Medicare assignment, the doctor can charge you more, but there's a limit to how much excess they can charge. They can charge 15% more. So if you're going to doctors that accept Medicare assignment, having coverage for this might not be worth paying more. But if you're not sure and you feel better about it and you can afford the additional premium, maybe it's worth getting the Plan F. So I point out a couple of those things on this next slide. Just generally, the least expensive is the Plan F. There's actually a high deductible option, but that means, of course, you've got to pay a higher cost up front. The second least expensive is usually Plan A, but as you can see, it sort of covers the least. There are the fewest number of checks. The best place to get information about these is from an insurance agent or broker, or contact the regulatory agency in your state that's in charge of insurance. And you can find contact information for that agency if you don't already know it on the NAIC.org website. So that's a website for the National Association of Insurance Commissioners, and they can you can find the contact information for your state and then get this Medigap booklet. So I think I'm going to stop for a minute and see, we're about halfway through, see if you guys have any questions about what we've covered thus far.
So we do have a question. Medicare told me that I had to take Part B even though I'm employed and have employer health insurance because we have less than 20 employees. Medicare is primary and my employer is Blue Cross Blue Shield. So I guess if you have any thoughts or comments on that, that would be helpful.
Yeah, that's thanks for bringing that up. So that is true. So when I was talking about whether you wanted to sign up for Medicare, what slide was that on? I did talk, sorry, I'm trying to find the slide number. Let's see here. There is those Medicare coordination of benefit rules. And those define who pays first. And it is true that employers with fewer than 20 employees can require you to have Medicare as the primary payer. So, so that is, I'm glad you brought that up. That is true. Some folks, I mean, you could have chosen not to get Medicare, but you would have been responsible for paying the, Medicare's portion of the bill. So you did the right thing. So that, I'm glad you asked the question to clarify, but that is accurate, yes.
I encourage anybody who has, at this point that's the only question we have. I do encourage people to chat in their questions. I see people who've registered and who are in this who I know I've spoken to about Medicare questions. So I really encourage you to just type it in so that Melissa can do her best to address your question.
Okay. Thanks, Sarah. So let's go on and talk about Part D. So should you get Medicare Part D? When should you buy it? Here are some questions you might want to consider. So in getting Medicare Part D, you might want to think about whether you already have coverage, whether you have some sort of family coverage that helps pay for your prescriptions already. You want to think about, if you have some other coverage, what are you paying for that coverage? What is the overall cost, meaning, the premium, how much you pay at the pharmacy, whether you have a deductible for your EGHP. That means employer group health plan, just your employer coverage. So you want to compare that with your potential costs if you sign up for Medicare Part D. Then the donut hole is a big consideration, particularly for you guys because you have a pretty expensive drug therapy. So we're going to walk through an example in some coming slides to demonstrate that. Then, of course, in the example we talked about earlier, if you lose your creditable prescription drug coverage through an employer, you get 63 days to sign up for a Part D plan without having a penalty. And then I'm just reminding you might already know, but creditable drug coverage as far as Medicare is concerned is something that's considered as good as Medicare Part D, which is potentially your employer group health plan, TRICARE, or Veterans Administration benefits. If you are retired, there are some different considerations. So, if you decide to sign up for Part D, instead of keeping the prescription coverage that you would be lucky probably to have as a retiree, would it impact any other benefits that you have, like vision or dental or hearing or life insurance? Sometimes if you've got a retiree coverage, you might not be able to get it back if you get out of it. Or, it might cause some of your family members to lose their coverage. So just some things to consider. So once you've sort of made a decision about whether you think you want Part D or not, the next best thing to do is to make a comparison of the Part D plans available to you. If you already have Part D, this slide is a reminder to shop and compare your plan every year. All of the things on this slide can change every year. The network of pharmacies can change. We've seen changes in the last couple of years, pretty big changes among plans about where you can go to get the best price, and those are called preferred cost-sharing pharmacies. Those are usually pharmacies that are chains that are sort of the bigger box retailers. But if you're looking at a Medicare Advantage plan, they can also change, the doctors that they contract with and the hospitals. So you need to be really mindful to look out for that. You change, you might be prescribed new medications, and you want to make sure that those medicines are still covered by your plan. Your costs can change, the plans can change, the premiums, the deductible, and then how much you pay at the pharmacy. The coverage of your plan can change. Drugs can be added or removed from the formulary or the drug list, and then the restrictions can change. Those limits about when and how you can get your medication. So you just need to be mindful to look at this stuff every year. If this is not something you want to do on your own, the link here is to get help from your SHIP, which is the State Health Insurance and Assistance Program, and so they offer free and unbiased help, and they're a really good resource. They get really busy during the Medicare open enrollment period that is coming up. So if you want their help to make this kind of comparison this year, I'd call them pretty soon. A lot of them begin to make appointments the first day of October. That's when this information is going to be available to make comparisons. And you actually have until the first week in December, until December the 7th, to make a change if you decide you want to. So let's talk about this in terms of a just patient. So Miranda is a just patient. She's had Medicare since last year. Her retiree insurance that pays for her prescriptions and paid after Medicare is ending next month. She's talked to a lot of folks, and she's determined that she needs a Part D plan and a Medigap policy, but she wants some help deciding on which plans are best to pay for her Gleevec or the generic and when she should sign up. So I will say this is a patient I actually did speak with. Obviously her name was not Miranda, and this is not her real photo, but this was a real situation that I did have an opportunity to help someone with recently. So I want to just kind of walk through the steps that we went through to try to get her some information. So we went to the Medicare.gov website. We clicked on this green tab that says Find Health and Drug Plans. I've circled here in green. Then it opened this screen. So this screenshot, I'm highlighting here that if I were you, I would use a personalized search. It does require you to enter your Medicare number and some personally identifying information, but I will tell you none of that information is stored in this website, so it's a protected and safe place to do this. This is a government website, so I would encourage you to do that because it will pull up your current plan that you're enrolled in and allow you to compare it to others. For this example, what I did was I went into the general search at the top. So I just typed in a zip code, which led me to this step 2 of 4 where you enter your drug. So you just start typing in the name of the drug. You click Find Your Drug. Pretty straightforward, pretty easy to do. Once you hit Find My Drug, then you get this screen, and this is where you would indicate the dosage of the drug that you take, the quantity you receive, and how often you get the medication filled. Now, a couple of tips here about this pharmacy business and frequency. So always set the frequency to 1 month, even if that's not what you get. I mean, if it's a medication that you only take as needed and you'll really only get it filled every 3 months, then list 3 months. But if it's a prescription that you're taking monthly, list it as monthly, even if you get a different number of supply. And second, always list the pharmacy type as retail. Listing mail order here throws off the pricing we're going to see in a couple of slides, and you will get a chance to see mail order pricing even if you say you get it at a retail pharmacy. Once you've entered a drug, you're going to get an opportunity to write down this password date, the drug ID list, and the zip code. So that's up here. I've circled it in red. Be sure and write this down. When you're doing this for yourself or your loved one, during the Medicare open enrollment period, there is a lot of traffic on this website, and having that handy will save you time in having to re-enter this information later. Once you get your drug list in, then you have an opportunity to select 1 or 2 pharmacies. I would suggest 2. The one that you use plus another one for comparison. You can see if your pharmacy doesn't come up, the drop-down box here is showing that you can change the number of miles that you're searching. So I actually changed, this is a pretty rural area, so I changed it to 78 miles, which, seems far, but I wanted to include a comparison of CVS, which is one of those pharmacies that you would expect to be offering this preferred cost sharing, and then ShopCo, which you would expect is a more independent local pharmacy, so we can compare prices. So once you've picked your pharmacies, then you get something that looks like this slide. It shows you that there's 26 plans available. Ignore this business over here on the left under the red X because it's limiting your choices, and we want you to be able to see everything available to you. So once you select the type of plans you want to compare, you'll get this summary page. There's a lot on this summary page. We're going to spend a minute here talking about this page. At the top left, I've circled there's 26 plans available in the zip code. So that's a lot of choices. But we're going to narrow it down to 2 or 3 to choose from. To do that, by these red arrows, these bigger red arrows, let me get my little pointer out here, you can click this box, and then you click this compare plans here to see the next few. But we're going to stay here for just a minute. This blue box here is really where you want to look initially, because that shows the full cost. That's including your premium, your deductible if there is one, and what you pay for the medications. So look at that estimated annual drug cost before you look anywhere else. That's the way that the list is sorted. In this particular case, remember Miranda, she's got 2 months of this year that she needs covered. So, maybe for her, this first plan would be good because there's no annual deductible. The second one listed here, it has an annual deductible of $360. But when you look over here at the first column, this price, the annual estimated drug cost over here where I said you should look first, there's actually a very moderate difference, like $9 over the course of the whole year. So there's a lot to look at here. The other really important thing you guys in particular need to check is this drug restrictions information. So if you clicked yes, this is a little actual hyperlink. It'll show you this information up here at the star. So the star is showing what are the restrictions. So for Gleevec, there's a prior authorization restriction and a quantity limit. So this plan would allow you to get 60 tabs of Gleevec every 30 days, which happens to fall within the needs of this patient, so that was fine. But a lot of information to look at here. So I picked 2 plans to compare. I picked the one on the left, this blue option, because it has no restrictions, and then the one on the right is the cheapest, but it has a restriction. So you can see it's kind of interesting. In the red box, there's a pretty big difference between the monthly premium and the deductible. But when you look at this full year cost here, there's not much actual difference through the whole year. So, my point here is be mindful of looking at the full year cost, not just the deductible or the premium, which you guys probably know this because you've had to shop this stuff. But take the time to look at this. The next slide shows how much you're actually going to have to pay. So this example of Miranda, she would be looking at, in this blue box, paying about $3,400 in November to get all of her medications filled. And that's because Gleevec is so expensive. We looked at the generic drug, and the generic was actually more expensive on these plans for the rest of this year. So for this particular patient, taking the brand name was the better financial deal. So once you get out of this donut hole business, you still actually owe a good bit in the catastrophic coverage, which is the red box. And this is where you guys can really do a lot to advocate for yourselves and to educate your elected U.S. Congressional delegation, the folks that are serving in your House and Senate. Take some of this stuff with you and show them how much you have to pay. These real-life examples, they need to see them because sometimes they're making these policy decisions and not really understanding the impact for actual people. So I wanted to talk just a few minutes about, what if you do all of this and you still can't afford your medication? Because it's a reality. I mean, it was a reality for Miranda. So there are some tools available. NCOA has a website called benefitscheckup.org. You can go in and do a check. Again, you don't have to enter any personally identifying information. It will screen you for over 2,500 public benefit programs that might help pay some of the costs of Medicare and other things like Medicare savings and low-income subsidy programs. It's a really great, easy-to-use tool. The other website, and there's several of these, but the one that I like best, it's called needymeds.org. It lists manufacturer assistance programs and foundations that might help pay some of your costs. So I've included a couple of screenshots here from Needy Meds. Again, there's more websites you can use. This is just my personal preference. You can go in and look for what are called state-sponsored programs. So you can see it's just a drop-down menu here. I picked the state of Maryland just because I know that they have this great program for people that have Medicare. Now, not all states have them, but I wanted to just demonstrate and show you, you just scroll through this list and read about them and see if any of them apply to Medicare. And so then you can click on this link and it gives you, more details. So it's a really good way to learn about whether your particular state has programs available. You can also look it up by the drug. So at the top left hand you can see there's Gleevec I've typed in. You get a screen that gives you lots of information about Gleevec. There's patient assistance programs, there's rebates and coupons, so you can take a little time to look through all of that. I clicked on the little pill down here. And that will take you to the next slide to get information. One of the things I really like about this website is they tell you about eligibility, if they can, if it's been reported. So that's in the red box, and you can see Novartis has a patient assistance program, which you probably already know. But the great thing about this is it tells you if people with Part D can get help paying. And this one says it's case by case, so you have to apply or call them. The phone number's there. You can talk to them. Another great thing about this website is that it lists foundations that might help pay. And it also always has a link to the website if there is one available where you can learn more. So this is a great tool. The next slide, this is just a screenshot of Benefits Checkup. This is the tool I was talking about earlier that NCOA developed that you can use to screen yourself and see if there are some other benefit programs that might help you pay some of your monthly expenses that would free up more to pay for your medications. I've got just a few more slides here of some resources you can use. Often we get questions about, does Medicare pay for these, different things, vision, dental. The answer is no. None of the things listed on this slide. But if you're looking for some other things, like we recently had an inquiry about home health services for a GIST patient. So you can go in, type in whatever it is you're looking for on the Medicare.gov website. You'll then see, it searches the Medicare.gov website, and then you pick whichever topic seems to fit best. In this case, it was the second one by the red arrow that says home health services. Sometimes home health services are denied because of a failure to improve, and that's really a myth. I mean, there's not a requirement that you have to improve. You can see I've underlined in red. It could be improvement, but it could also be to maintain your current function, level of function. So I wanted to just make sure you guys know that that's available. This last slide here has some great resources. The Center for Medicare Advocacy has these really wonderful self-help packets for all sorts of things related to Medicare appeals, including outpatient therapy denials and home health. The SHIPs I mentioned earlier, there's the toll-free number and the way to find them if you want their help comparing plans. the National Council on Aging, which is where I work, the Medicare Quick Check we talked about earlier, and a tip sheet about the donut hole that provides more detail about what that is and how it works. And then also there's some great tools from the Medicare Rights Center called Medicare Interactive and Dear Marcy. If you're just looking to sort of learn more about Medicare, these are great ways to do it. Finally, here's my contact information. I just want to thank you guys for the opportunity to talk with you today about Medicare, and I think we've got just a couple of minutes left if there are any additional questions.
Great. Thank you so much, Melissa. Yes, this presentation has a lot of resources in it, so I just want to let everybody know that we're going to make this available after this live webcast today so that you can link back to these resources that she's providing. But just to get to the questions real quick, if I retire and lose my company insurance, how can I be sure which Part D plan will provide the brand drug and not the generic drug for the GIST patient?
Oh, that's a great question. Thank you for asking that. So on the plan finder that we walked through the screenshots of that, you can see that detail on the plan finder. So if you want to try using that plan finder through the Medicare.gov website yourself, do that and list that you want to take the brand medication. It gives you an option to pick the brand or the generic. And if you get started in there and you think, boy, I really would like someone to talk to about this and make sure I'm interpreting this correctly, the SHIP folks that I on this slide here, they are a great resource to talk to sort of clarify, or if you just want somebody else to sit down with you and walk you through it, they're a good source for that as well.
Okay. Also, just somebody had asked about explaining the donut hole, but because of our lack of time, we'll send you that this presentation with the link to the donut hole tip sheet, because that will probably help explain it. And then, of course, Melissa provided her contact information if you still need somebody to verbally break it down. I'm sure she can help out with that just because of our lack of time. Just going to the next question, please clarify the matter of exception for COBRA. That person didn't really quite understand what you were explaining at that moment.
Sure. So COBRA, the coordination of benefit rules, meaning who pays first, related to COBRA and Medicare. So if you have COBRA, you should join Medicare to pay first, because you may get stuck with a portion of the bill that Medicare would pay. So it's important to look at that really carefully.
Okay, great. I'm going to just slip in one last question that just came in. If I'm applying for Medicare for the first time and go on the Medicare.gov website for the personalized search, how do I review the Plan D, as in dog, options if I don't yet have my Medicare number?
Oh, good question. So in that instance, just use the general search, and that was listed on the slide. All you do is you enter your zip code. The reason I was recommending using the personalized search is if you've already got Medicare and you've already got a plan, because it makes it easier to compare what you have versus what you could get. So if you're new, yeah, just use the general search and by zip code. That would work well as well. Okay,
great. Okay, so we're out of time, but I hope that everyone found this presentation helpful. It's a lot to pack in because Medicare is so huge, but we did really try to break it down because there have been a lot of questions on our listserv about it. So you can come back to this presentation and then go back to some of those websites that she provided, and also you can always come back to us to ask questions, and we can do our best to search and help find those answers for you. So I want to thank Melissa for her time today and helping us out and answer our questions. And I want to thank everyone for joining us and wish everyone a lovely day. Thank you very much.